I hope your first practice patient encounter went well. I know it's a lot to take in, especially since we're just starting out here at school, but I'm hoping that this YouTube video will be kind of a good little thing to help cover stuff that either was unclear whenever you guys were first going through it, or maybe it'll add something that you didn't think to look at afterwards. As always, just with any of the past videos we've put out there before, make sure if there's anything that's unclear that I don't go into great detail about, or I do go into great detail about and the professor never talked about it, make sure to clarify with the professor. So, for your patient encounter, as you know, we've already covered old kartsa. That is for sure. So that's your mnemonic here, where you have your onset, location, duration, condition, aggravating or alleviating, radiation, timing, setting, and associated symptoms. That stuff I feel like you guys at this point have got down pretty well. And for your patient encounter, one thing I always recommend is to go through, and your sheet should look very similar to this. If not right when you walk into the room, at some point during your encounter, you will want it to look very similar to this. The reason being why I would recommend doing it before the room is this is like going to be your first patient encounter. Nerves and adrenaline's going to be running high. I know for myself, I get nervous sometimes in front of others. And so this is a good way to kind of remind yourself what questions you need to be asking as you're going through your patient encounter. The first one for sure that you need to make sure to write on top, get the patient's first and last name and their age. It's very easy whenever you get going on your patient history to just forget about the basics. So once you have your name and age and your chief complaint, then I would recommend start getting into like the meat and potatoes, so to speak, of your history. So first thing you always want to identify after you've washed your hand, entered the room, washed your hands, and introduced yourself as student doctor so-and-so, I always recommend asking them, after you get your name and age, what brings you to the clinic? It's a very straightforward way of getting the chief complaint out there first, and it's kind of a good way to kind of lower the stress of the environment, I guess you could say. Then once they list their chief complaint, you can just always ask, okay, when did it happen? With one finger, could you point to me where exactly it hurts? How long has it been happening for? Could you describe the pain on a scale of 1 to 10? Is it a throbbing pain? Is it a dull, aching pain? Is there anything that seems to make it worse, like, for example, exercise or moving that area? Or is there something that seems to make it better, such as putting ice on it? Does rest make it better? Whenever you start feeling the symptoms, does it seem to be spreading anywhere else besides the place that you pointed at? Does it seem to happen as far as timing early in the morning? Is it in the evenings? Does it seem to be random? Were you doing something whenever you first noticed these symptoms? Were you watching TV? Did you fall down and that's what caused these symptoms? Like, what were you doing when you noticed that these things started to hurt? And then as far as associated symptoms, just check, okay, is there something else going on down the line? Especially whenever you get into like OMM, you understand that everything's connected. So they may have an injury in like the arm or upper extremity. Check to see if they have any like abdominal pain associated with it. Or maybe they have something wrong with like their lower back. As you know, like I said, everything's connected. So it's always good to kind of check everything holistically. Once you get through your old kartsa, which shouldn't take more than maybe a minute and a half or so, you should start thinking in your head, okay, what are possible diagnoses? What path in kind of the branch that I'm going through do I want to kind of explore? So that way when it comes to typing your SOAP note, you already kind of have an idea on what you want to put down for your plan and assessment. So those ones we can get into later. So now we have our old kartsa down with our chief complaint. We'd go into past family medical history, which we have written down here. That one's pretty straightforward. You just ask them about immediate families to check to see if what they have is possibly a genetic cause. So you'd ask following up, so are your mom and dad still with us today? How's their health? So you would ask, how's your mom? How's your dad? And how old are they? How is their health? And of course, document that. Do you have any siblings? Then they would answer. And then, do you happen to have any children of your own? And then go in and see if they have any history there. Family, because I know we're on a time budget, sometimes it's hard to get family history because there's so much other stuff. But I would for sure, if I were to put things that you absolutely need to for sure get down, you want to prioritize your old kartsa, and you want to prioritize your review of systems. And then if you can try and go through your past medical history and your family history, and then whatever social. For me, social history seemed to come into more naturally, just as kind of like, say, for example, if you were just like meeting someone new. So you can kind of get away with doing the social history as you're doing the physical if you're super confident in your history taking skills. If you're first getting started and you just need to write down everything, then it probably wouldn't be a bad idea to get your social history while you're doing the interview at the beginning of your encounter. So right now, just to kind of recap, we've gone through old kartsa, we've gone through our family medical history. So let's go through our past medical history, our PMH. Here we have all the different things that I feel that you will encounter through all these things. It's past diagnoses, past surgeries, past hospitalizations, whether those happened when you're an adult or when you're a kid or under 18 years old. This one is something that it doesn't seem to get talked about a lot, but it is exceptionally important. Have you received any blood products or transfusions in the past? Sometimes you can have delayed reactions after you've had like a blood product or of some sort, especially if it was like within the past 6 months. Exams. Exams will include such as for a female, when was your last pap smear? And when was your last mammogram? And you would also want to include when was your last menstrual period. And then, of course, if there was anything abnormal with those, go into more detail, asking them, could you describe that more? As you're doing your history, it's very important to, I guess you could say, like, be purposefully vague. So that way the patient tells you and describes symptoms. You aren't filling in the gaps for them. And then for exams for male patients, if they're an older male, you would want to ask them, when was their last prostate exam? Have you had a prostate exam? And then for male and female over the age of 50 years old, you want to ask them, when was your last colonoscopy? Or if you've had a colonoscopy. Okay? And we come down here and you want to cover your allergies. You have 4 main categories, which let me write those down to make it easier for you. Allergies. You would want to cover your seasonal, which right here in fall, I'm sure we know somebody that's going through problems with their seasonal allergies. You'd want to cover any food allergies, any medication allergies, such as sulfa medication allergy is a common one that you would want to watch out for, or possibly a penicillin allergy. And so we've got seasonal, food, medication, and then latex allergy. So you would want to avoid wearing a latex glove whenever you're examining somebody that has a latex allergy. So those are our big 4 that you absolutely want to cover when you're talking about allergies. Immunizations, those are your generic childhood immunizations. Usually you can just say, are you up to date on your immunizations? You don't have to be much more specific. I do know you want to ask, have you received your flu shot yet this past year? And I know with fall coming up here soon, it's very exceptionally important to stay on top of like the flu shot. And medications, this one, you want to make sure that you document what medications they are currently taking and the dosage of it. And that you should just try and write down as fast as you can. Sometimes it's hard to pronounce drug names. I'm in the middle of pharmacy, and I can 100% empathize with that. Just do your best to try and sound out the words. If you can't get it quite as well, just do the best you can, and that's all you can ask for. So that covers the past medical history. And here's kind of here's a good mnemonic, which shout out to Kate Glover. She was the one who actually shared this with me and gave me permission to talk to you about this with you guys. But she gave me this awesome mnemonic because I'm from rural Arkansas, and this just seemed to stuck with me. If it helps you guys, great. If not, I'm sure there are plenty other mnemonics for past medical history that'll help you out. But Dad sucks at hunting Tem-I. So at the very least, you get 4 out of the 8 past medical history things that you want to ask about. But Dad sucks at hunting Tem-I. Okay, so now once again to recap, we've got name, chief complaint, old kartsa, family history, and past medical history. Let's move on to our social medical history. The big 3 I always make sure to ask for social medical history is sex, drugs, and alcohol. And you can include rock and roll in there if you want to, I guess. But for sex, it's asking, are you sexually active? And then it's a good follow-up if they say yes, with whom? Once again, it's a good idea to be purposely vague so that way the patient can fill in and describe details of their past history without you filling in the details for them. It is also because I know I'm an extremely awkward individual. To just kind of preface this, just wanted to let you know we're going into the social medical history. If any of these questions I ask you make you feel uncomfortable, let me know and we will move on from there. And that's all you need to do as far as that goes. Whenever it comes to drugs, you want to ask about illicit drugs and then have them describe to you. And then also smoking history. If you smoke, do you smoke cigarettes? Yes or no. Do you smoke cigars? Yes or no. Do you use chewing tobacco? Yes or no. And then alcohol, you want to ask, do you drink alcohol? If so, what kind? And then you would follow that also with how much, like what volume. When you drink alcohol, like, is it a full glass of wine or is it a half glass of wine? Small little details like that really add up and make a big difference. Occupation, what job do you do? Like, for example, does it require a lot of heavy lifting and cause you a lot of low back pain? Were you in the active military before? Yes or no? That's because if you ever go to overseas and you suspect some sort of like infectious disease they may have gotten, or some sort of like somatic dysfunction they got while they were in the military. Travel, same thing. Did you go overseas or to a different area where a disease is more prevalent than it is here? Your dailies or your ADLs, are you still able to brush your teeth and take care of yourself? Do you have someone that helps you with that? And then stress, I know as med students at this point, we can all relate to stress and the symptoms that can go along with. So just make sure that these things, I would say that it's hard to get all of these things in on your history, which you do want to keep under 7 minutes about. Sometimes it will go up to 8 minutes, but I would, when it comes to practicing, do your very best to keep it under 7 minutes routinely. And then when it comes to the real deal, you'll be very well prepared for it. And then finally, for like our history, we come to our ROS. That's our review of systems. I believe for our first encounter, you're expected to cover 5 review of systems. But whenever you reach to a later stage, you will be expected at some point to do 10 review of systems, which can get very tricky, very time-consuming, and very difficult. However, after you've practiced it enough times, it will come very naturally to you, I promise. For the review systems, the way I always preface this whenever I'm giving history is you always want to say, okay, well, we're wrapping up our history here, and I'm so thankful for your time. I have a series of yes or no questions for you. All I'll do is just throw questions at you, and you just need to respond yes or no, and we'll go from there. And then usually the patient will be, okay, go forward. And then so the big 3 that you absolutely need to have are these. Your conditional. Have you had any sudden weight loss, weight gain, any fever, any chills? And make sure that as you ask a question, have you had any fever? Yes or no. Have you had any chills? Yes or no. Do not stack questions one on top of each other. It'll get you mixed up and it'll get your patient mixed up. Same with cardiac. Have you had any shortness of breath? Have you had any chest pain? And so on and so forth. Have you had any palpitations? And then you want to make sure to ask minimum of 2 questions per system before moving on to the next system. And finally, for the big 3 rounding out is you have your lungs. Do you have any shortness of breath? Do you have any pain while breathing? Do you have any wheezing while breathing? Do you have a history of asthma? And I went ahead and copied and pasted all of kind of like the recommended questions that you can have. And I made sure to go in and highlight each of the areas for the big three that I mentioned. Like I said, do you have any cough? Do you have any wheezing? Do you have pain while you're breathing? Cardiovascular, which is the heart. And then here are some of the rest of the systems that you would want to cover. I know my personal big favorite, because I know you guys are needing a minimum of 5 for your review systems, is GI and GU, which is gastrointestinal and gastrourinary. Is, do you have pain while urinating? Do you have pain while passing a stool? Do you have blood in your urine? And do you have blood in your stool? Those are quick and straightforward questions to kind of get through your review of systems if you're running short on time to meet that 7 to 8 minute time quota before beginning the physical. Of course, I included this and the rest of the systems here for you guys to make it easier. If you ever have any questions as far as the patient encounter goes, please feel free to reach out to me directly, and I'll do my best to help you guys out. I know that this sheet was extremely helpful for me and my patient encounters, and I still continue to use it today. Be sure to practice your SOAP note. For your SOAP note, be sure to go in there and start from the bottom up. Start with your plan and come up with at least 3 different areas. Start with your assessment, come up with at least 3 different things. And then work on your vitals, put your objective, and then subjective. It just is a big old paragraph, and it just takes time. So I hope those tips are helpful for you guys. Like I said before, if you have any specific questions, feel free to reach out to me. And I wish you the best of luck on all of your future patient encounters.